Jana from Canna and we are at the 2016 Homegrown Maine show at the Augusta Civic Center. We are talking to attendees and vendors about medicinal cannabis. Please join us inside the grow tent with Canna docs. Hi, we're here with Jessica Goulet. She works at our Canna office in Biddeford. So Jess, how did you get involved in this in the first place?
Well, actually, I've worked with Jana for multiple years, and as
Jenna's
a coworker,
our manager.
Yeah, Jenna's our main manager for Canna, and I was one of her coworkers at the 99 restaurant, and she knew my bubbly personality. She knew that I was a fun person, that I was always happy, came to work with always a smile on my face. So she was like, "You're going to be my receptionist," and I said, "Was that a question?" And she said, "No." So that's how I got my job.
This is Heather Lemire. She's a provider at our Biddeford clinic. So how did you get involved with the medical marijuana program initially?
I actually was out of a job, and I was looking for a job, and this job kind of fell into my lap. And I'm so glad that it did, because it's become so much more than I ever expected it to be.
This is Dr. Uma. How are you doing?
I am wonderful, honey. How are you doing today?
I'm wonderful. So, I've heard, you're obviously a huge force in this industry. So tell me how you actually got into it in the first place.
You know, it's very interesting. I actually got into this because I lost my mom about 4 years ago, and about a year and a half before she passed away, I saw a TV program about how cannabis was being used in Israel for COPD, asthma, and lung cancer.
Right.
And I could not understand how this could be, because my whole life as a physician, in my first life in family medicine, I told people not to smoke.
Of course.
And then in my second life in occupational medicine, I protected them, so we did surveillance exams. And at that point, the curiosity began, and I started to look into how this works, and then I found out that there was a beautiful system known as the endocannabinoid system.
Absolutely.
And with over 30 years of education, I had never heard about the endocannabinoid system. And then I found out that it was actually over 600 million years old that it's evolved from, and that anything that has a vertebral column or a spinal cord has this beautiful system. So that's where my journey began, and I love it now.
I know. You're obviously like a big part of it. We see you.
Well, I injured myself irreparably about 5 years ago, and I was told that I would never walk again. I was put immediately on opiate therapy. I discovered that I was mildly allergic to opiates. They made me very, very sick. I decided to go back to my roots. I'd always been a recreational smoker, and I remembered it being very helpful for anxiety, so I thought maybe there would be something to it for pain. I got my medical recommendation from the wonderful Dr. Sulak. He actually took the time to see me because he'd never seen anybody with my condition before, so he got to know me that way. And then I started using medical grade cannabis, and within 3 days I was able to put weight on my foot for the first time in 6 months.
That's incredible.
And within 6 months I was completely off all other medications, including the opiates, and I was able to walk completely unassisted.
Oh, that's amazing.
I also work with leadership and ethics, however, as well. And I really do think this is a compelling ethical issue for us as a culture to be grappling with. We have a medicine that is a natural plant medicine that is non-toxic, that helps so many people, and yet lots of people still have difficulty accessing it, and that's really a problem. In addition, from the moral perspective, we are locking people up for possession of a non-toxic healing plant. And so as an ethicist, which is my kind of line of work, I find this they're very, very, very compelling issues to be looking at. So I'm glad to be here.
Awesome, that's great.
I was on some, and I also have some problems myself, so I had post-traumatic stress in the worst possible way. I couldn't work for 4 years, and I had had a very successful insurance business for 22 years. Couldn't even work. I had 3 children, and I started to take cannabis and CBD oil because I was getting sick of the drugs that they were giving me. And I also have pain issues, and I was on pain medication. I've gone almost off of the pain medication now, and I would have lost my train of thought 10 times in this conversation had I not done this course of action. The CBD oil restored my brain.
Really?
I really believe it. It's just, it's a miracle to me.
Right.
And so it's really improved my life in a tremendous way.
Oh, that's great.
You know.
So hi, we're here with Joshua Parker. And my name is Jana. So how did you get involved in the cannabis industry?
Oh, well, it started about a year ago. I was with Regulate Rhode Island, and we were going door to door campaigning in Nick Mattiello's district, and we were just trying to educate people on why.
So now I'm an educator and an activist. I have my own seminars, Sensimia seminars, and I'm also an educator at the Northeastern Institute of Cannabis over in Maine.
Awesome.
You know, I'm interested in helping the vets. I'm interested in helping cancer patients. I'm interested in helping children, and I've got a real bad back myself, back pain, so it helps me. And I've just been involved with it in many different ways,
Absolutely.
a lot of different avenues.
Awesome. So,
Well, I got diagnosed with Crohn's disease, colitis, about 4 years ago. I always knew the benefits of it,
Right.
And now I'm privileged enough to be able to have that in New Jersey. I'm very fortunate and thankful for that, because it's the first bit of relief I've received in
Right.
probably about 10, 15 years.
really?
I'm a family physician.
Okay.
I've highly believed in the medical benefits of cannabis for years and years.
And where are you based out of?
Florida.
Florida.
Clearwater, Florida.
Okay, so is there a medical marijuana program in Florida right now?
Not yet. It's coming up for vote in a few more months, so we
Absolutely.
are anxiously waiting for it to pass.
I came into this world because I was working in the HIV/AIDS social work world.
Right.
And I started seeing, I've used this medicine all my life, but never really felt like it was medicine. I was medicating myself somehow. But I saw that people who were living with HIV/AIDS, who were on medications, people who weren't on medications, almost to a person, used cannabis to alleviate their symptoms. And so how was it that here was a person who used it for sleep? Here was another person who used it to eat. Here was another person who was on these, heavy-duty medications, antiretrovirals, and that was helping them with the nausea. It was helping them to just get through the side effects. But here was someone else who used it, and it helped them to sort of get up and go to work. Here was someone else who used it for a little bit of motivation and just calming. So how is it that this one medicine treated all these different things?
Such
And
a variety.
So following, these little golden threads that sort of started appearing for me when I started thinking about it as medicine, that's how I ended up sitting here in 2016 in this tent in this incredible new world we have.
I love the smiles that I see. I love the patients that come back in and say, thank you for giving me my life back. I have patients that come in and say, I can play with my grandchildren. I can go out and be with my family, don't have problems, and I enjoy my life. And that's what I love so much about my job, is giving back to the community.
So tell me what you do in the cannabis industry.
I am the local market rep for Weedmaps, and I try to connect patients to doctors, dispensaries, and deliveries.
Oh, that's wonderful. So when did you get into this?
I started in March 2016, but I've been in the cannabis industry for almost 2.5 years now.
And how did you get into it? What drew you to it?
I went to school for science, and then I was working in a lab testing it out west. And then I just recently moved back to Massachusetts and started to look into jobs still working in the industry.
Women in the industry is so important, just to let them know that this is going to be a safe space for them. This is an upcoming market, but it's for absolutely every and anybody. Anybody with an endocannabinoid system.
Right, absolutely, which is everybody.
Right now.
I am an independent caregiver. I work with a small number of patients, a very small number of patients. I'm kind of a one-woman show. I do everything from, planning, growing, preparing, harvesting, and treating my patients with this medicine. So I keep my practice small. I add other, complementary care to that. I'm a Reiki master, and I think that Reiki and cannabis go together really, really well.
So what exactly does Verde Labs do?
Verde Labs is an ISO 17025 accredited laboratory, one of the first labs to be ISO certified with one of the broadest scopes of accreditation in the industry. So we're an independent testing laboratory. We basically provide patients, caregivers, dispensaries, researchers with the analytics that they need to know more about their medicine and understand how it actually affects their systems and all that.
My clinic is more what I call total healthcare, THC.
I love it.
And it's not just about certification. I'm about the whole patient.
Right.
And I made a statement over 2 years ago that cannabis is not an entrance drug, it's an exit drug from pharmaceuticals and narcotics, and I truly believe it.
Yeah, I think a big issue really is education. People aren't aware of this, and as people become aware, you see more and more people like here at this. I'd like to also say though about Canna docs, if you don't mind me jumping right in.
Yeah, I love it.
No, I mean I really think that Canna docs is providing a very valuable service. I mean, there are many doctors who are still falling under restrictions with hospitals that have federal prohibitions about getting involved with cannabis. So the number of doctors who can really step forward and take that stand and certify is limited. And so for Canna docs to be available and for people to be able to come and be certified and get the medicine that is so healing is really a great service.
The goal is to make it as easily accessible as possible.
Yeah, absolutely. And we're here in a grow tent, right? It's about growing people.